My name's Bertrand Dirk, and today we'll be discussing about vertigo cervical headache. Now, vertigo cervical headache is also known as vertigo migraine or vestibular migraine. Now, this can result in dizziness, unsteadiness, or even vertigo-like symptoms. Now, headaches or migraines in the head can also be present, but at times can be absolutely absent during an attack. Now, sufferers may experience nausea and vomiting, as well as mild to moderate pain in the head, either on both sides. Symptoms are often exacerbated by sudden movements of the head, turning the head to a particular side, or when maintaining the head in one position for a prolonged time. It can also be triggered by physical exertion, exposure to bright lights, visual disturbances such as walking and looking down the aisle of a grocery store. It is also worsened when the discomfort is felt in the neck. And in some cases, vertigo cervical headache can occur for no apparent reason. Now, vestibular migraines can often be confused with other conditions, including BPPV, known as Benign Paroxymal Positional Vertigo, Labrynthitis, and even Menier's disease. And it is important that sufferers who experience any form of dizziness, imbalance, or vertigo issues have a thorough assessment to properly diagnose their condition. This will ensure that you receive appropriate vertigo treatment and vestibular rehabilitation. Now, in terms of vestibular migraines or vertigo cervical headache, there are four main symptoms that a sufferer can exhibit. The first one is dizziness. So what is dizziness? Now, dizziness is an internal sensation in the head, such as lightheadedness, heavy-headedness, unsteady in the head, fogginess, or wooziness. The second symptom is something called vertigo. Now, vertigo is an external sensation whereby you feel the environment is spinning or the world is spinning around you. Nystagmus often occurs whereby muscles around the eyes contract, resulting in involuntary eye movements. The third symptom is imbalance. Now, imbalance is a physical sensation whereby sufferers will feel unsteady on the feet, or they will overbalance, or they may veer off to the side when they're walking. And the fourth symptom to have is a headache or a migraine. Now, pain in the head, such as headaches or migraines, can occur during an attack. In many cases, though, headaches or migraine can be completely absent, whereby sufferers may feel aura-like symptoms such as nausea, vomiting, visual disturbances. Now, the other symptoms that may often be confused with vestibular migraines is, once again, BPPV, Labrynthitis, or Menier's disease. So we'll go into greater detail about what these are and what the differences are. Now, BPPV is a disorder of a problem in the inner ear, involving small calcified otoliths, which are calcium crystals moving loosely in the inner ear. Now, if these otoliths are dislodged and move freely in the inner ear, it will subsequently result in vertigo and vestibular symptoms. Now, a person suffering from vestibular migraines can often experience symptoms similar to a person suffering from BPPV. This often causes many health practitioners to misdiagnose and label a patient having BPPV when they in fact suffer from vestibular migraines. Now, the other condition is called labyrinthitis. So what is labyrinthitis? Labyrinthitis is an inner ear infection. The labyrinth is a structure in the inner ear that can be considered as a balance center. Now, when inflammation to the labyrinth occurs, usually due to infections, you may have issues with balance. The most common cause of labyrinthitis is from a viral infection. Now, this can be from cold or flu virus, or the herpes virus group. This is the virus that can cause chickenpox, shingles, or even cold sores. Sometimes infections can lead to labyrinthitis. Now, labyrinthitis may be diagnosed by a series of tests, including hearing tests, balance tests, eye tests, head movements, blood pressure, and sometimes other tests such as scans may be performed to diagnose whether a sufferer has labyrinthitis. Now, the other condition that may confuse health practitioners is something called Menier's disease. Now, Menier's disease can cause a variety of symptoms, including dizziness and vertigo, tinnitus, which is ringing in the ears, hearing loss, feeling of fullness or congestion in the ear. Now, Menier's disease is also a condition of the inner ear where there is a buildup of fluid in the labyrinth. Now, the fluid buildup sends signals to the brain which interferes with normal signals. Hence, you may feel the symptoms of Menier's disease. Now, this can occur to people of all ages, however, it generally affects people ranging from 40 to 60 years old. So, as you can see, there are many conditions which can mimic cervical headache or vestibular migraines, such as BPPV, labyrinthitis, or Menier's disease. So it is highly important that if you do suffer from any forms of dizziness, vertigo, unbalanced sensations, that you seek a health professional that can hopefully rule out and diagnose you correctly. So then what is the cause of vertigo migraine or vestibular migraine? Now, through current research, the vertigo migraine has found to be a result of a dysfunction in the neck. It can also be associated with other injuries to the neck, such as whiplash injury or head injury. However, it may also occur for no apparent reason or cause. Now, those with this disorder typically have a dysfunction in the upper 3 cervical spine, which causes a sensitized brainstem. Now, the brainstem is found at the base of the skull and into the upper 3 vertebrae. It basically filters information that passes into the brain, including motion self-awareness and head equilibrium position. A cranial nerve, such as the vestibular cochlear nerve, which innervates the inner ear, can also be affected, resulting in vestibular-like symptoms such as dizziness, vertigo, or unbalanced symptoms. Now, because these information pass through what is now a sensitized and heightened brainstem, those with this dysfunction will now have a higher risk in suffering from dizziness, vertigo, and unbalanced symptoms. They may also have associated features such as headaches and migraines. So, in terms of whether you suffer from vestibular migraines or you have symptoms such as dizziness, vertigo, or unbalanced sensations, then we highly recommend that you seek a health professional that understands vestibular symptoms or who understands vestibular migraines. If you need to seek any further clarification on vestibular migraines, then feel free to contact us. Our number is 1-800-HEADACHE. Once again, my name is Bertrand Dirk, and I hope you have learnt a lot from today's session.